Atypical antipsychotics, these are the newer generation antipsychotics that came out starting in 1994. They're called atypical only because they don't produce as many extrapyramidal symptoms, like Parkinson-like symptoms, tremors, rigidity, akathisia, tardive dyskinesia, and so forth. And they were all originally FDA approved for treating psychosis, but they also, all of them are anti-manic, and we'll come back to this later, anti-aggression. They probably are the best drugs for treating severe aggressive problems that are seen across a wide array of psychiatric conditions, so they have multiple uses. Now, here's the list, okay, and the extrapyramidal symptoms that we're seen frequently with the typical antipsychotic medications, the one that was of greatest concern is tardive dyskinesia, okay? And where people would develop what oftentimes were very persistent abnormal movements, especially lip smacking and movement, writhing movements, you know, in the upper torso and so forth. What's that? Like Haldol and Thorazine and Prolixin and stuff like that. Also Parkinsonian symptoms. If you go to state hospital, it used to be, if you watch people, they say, oh, these people look weird. They don't look weird because they have mental illness. They look weird because they're taking antipsychotic medications, and you know, the shuffling gait and that sort of thing, and tremors and things like that. And so these were heralded as being major breakthrough, you know, new generation antipsychotics, until they found out that, they've got their own set of side effects as well. The two on the bottom are the newest ones. I have zero experience with either one of these. They came out in December or November of last year, Fanapt and Saffras. And actually, I'm not going to really get into that. I mean, touch on those when we talk about psychotic disorders in our next class, but they're like a lot of new drugs. It's hard to know if they're going to be, you know, effective or dangerous or what have you. Let's just give it some time. But these are the biggest problems with this class of antipsychotic medications, and together they are referred to as metabolic syndrome. And weight gain is seen with many of them. When it says increased cholesterol, talking about increased LDL, or bad cholesterol, and triglycerides, hyperglycemia, and it can either cause or significantly aggravate type 2 diabetes. And I want to really be clear about this. When these problems occur, it's a very big deal because it can set in motion changes in the body that, if you don't control that, can kill people. I mean, not right away, but you know, in the long run. I mean, they huge health consequences. And also, these metabolic side effects are seen to occur even more frequently in teenagers and children. And lots of these drugs are used to treat bipolar disorder in kids, but they're also used to treat especially aggression problems in kids, and they're used with lots of developmental disabilities like autism spectrum disorders and mental retardation and so forth. So this is something really to be on the lookout for. Now, the newest drugs are not on this list because they just came out, but there was a consensus conference that met together psychiatrists, but also endocrinologists pooling data, international studies together, and here's what they came up with is the drugs that are the most likely to cause this wide array of metabolic problems are Clozaril, which I'll talk about separately, and Zyprexa. And remember that Zyprexa is a standalone drug. It's an antipsychotic, but it's also a key ingredient in Symbyax. So that's one of the reasons Symbyax, I think, is not used very much. The least likely to cause it are Abilify and Geodon, and then the other drugs are somewhere in between. Saffras and Fanapt, the new drugs, I don't have any idea about that. They're too new to really know. But what this means is that people on any of these drugs, and this is even highly recommended, even with Abilify and Geodon, need to be checked very frequently, usually a baseline and a couple of times a year. Check cholesterol levels, triglyceride levels, blood glucose levels, weight gain, body mass index. Really stay on top of this stuff. And I want to tell you that I had experienced one of my patients. This man had severe chronic PTSD, and he would have quasi-psychotic symptoms at times. And actually, what ultimately worked for him very well was a combination of an antidepressant and very, very low doses of antipsychotics. Okay. But this was before anybody knew about this, and this man was on Zyprexa, and it was working beautifully in getting rid of the psychotic symptoms. But he gained 50 pounds in the first year. He developed dangerously high levels of triglycerides and cholesterol. And then his primary care doctor started treating him with drugs to combat high cholesterol and triglycerides and push the dose up so high he got really sick on that. And this is like this polypharmacy cascade. You keep adding drugs on to treat side effects. And this guy became very physically ill, mainly because of taking too many drugs. And then the studies came out that says, hey, Zyprexa is notorious, for causing like 1 pound weight gain per week and high cholesterol. And oh my God. And so he got off of Zyprexa, and he actually was put on Abilify, and all the metabolic things went away. His weight came back down. He's doing just fine.